Hello and welcome. It's 11:30 a.m. here in Seoul. I'm Kim Do-yeon at the Arirang News Center. We're breaking into our regular programming to bring you the latest live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into our regular programming to bring you the latest on the briefing from the Sejong government complex with simultaneous interpretation in English. Park Kyang, a senior official at Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. The briefing will give us an update on the number of new infections as of midnight, as well as any trends and the latest on the vaccine rollout. Also, on the social distancing measures imposed on the country. To give you a brief idea as we wait, South Korea on Tuesday reported an additional 1,372 new cases. Now let's take a listen to what the health authorities have to say.
존경하는 국민 여러분,
Ladies and gentlemen, and also members of the Korea's Health Care Association, together with the rest of the public, we are also exerting our full efforts to contain fully the fourth wave of the COVID-19. Nevertheless, we are seeing the emergence of the Delta variant, which is spreading very fast and hindering our efforts. Lately, we have also seen a daily tally that has surpassed over 1,800, and nevertheless, our medical response capacity is also responding well to such an outbreak. And given the situation here in South Korea, we have about 18,000 hospital beds nationwide that are used right now to treat COVID-19 patients. And right now, it is also very much due to all of the efforts put forth by the healthcare providers and their sacrifices as well, who have made this possible. And despite the scorching heat, there are many people who are exerting their full efforts on the forefront of fighting against the COVID-19 by wearing the protective suits. And I would like to take this opportunity to thank you once again. And the government has begun its 12 rounds of negotiations starting from May with the Union of the Korean Health and Medical Workers. And yesterday as well, we carried out an hours-long discussions with the members of the healthcare community. And to this end, we are also responding to the 8 major tasks that have been recommended and also requested by the union, and the two parties have discussed very candid talks. However, we have also found difficulties in narrowing the gap entirely. However, we were able to share a large consensus. However, we believe that there were some gaps between the two parties in specific matters. For instance, as for policies that were sensitive to these medical fields, we believe that there were also some of the matters that have to also carry out more stakeholder meetings, because these cannot be agreed upon just between our two parties. And we believe that not only the healthcare providers, but also there are many other stakeholders, including the members of the Korean community and also many other Korean healthcare workers and medical workers who are not part of the union, and we need to take into their situation into account as well. We understand your difficulties that you are experiencing right now, but we want to once again urge you to also ask for our consideration. And once again, the government will also exert our full efforts to seek a resolution to this end going forward. And we believe and we hope that we can have more continued talks between the two parties. And here is a response from the Welfare Ministry. And the Health and Welfare Ministry will make sure first to ensure enough budget to provide a necessary working environment for the medical workers. And they include the life insurance benefits as well as emergency nurses appliances as well, and these will be taken into account very soon. And second, we will also make sure that there are more people mobilized to work in the public health field. However, we believe that this needs a large amount of budget as well as human resources. To this end, we will have a consultative body overseeing such a public healthcare scheme here in South Korea, and we suggest that we establish this consultative body as soon as possible. And third, we will make sure that we provide an improvement to the working environment. And we will also have improvements made to all of the requests that you have made. And the government will make sure that we share the same consensus on such points. However, these are not only limited to just the budget aspect. However, we believe that there are many other aspects that we need to take into consideration. For instance, the equal distribution of human resources going forward. And to this end, the government will make sure that we narrow the gap going forward. And in order to resolve this fully, we believe that there needs to be candid talks and also legislation amendments, and we believe that these could also take more time, and it is difficult for us to also immediately solve all of these issues at once. And fourth, we believe that we will also work with the medical circles to improve the culture of the hospitals. And as for the operating rooms and the surgery rooms, we believe that there are many difficulties and challenges. However, we will make sure that such environments are also made well going forward. Ladies and gentlemen, we believe that it is the common goal of the government as well as the medical workers to protect the valuable lives of the public. And we believe that these cannot be put at stake at any moment, especially with the planned strike by the Korean Health and Medical Workers Union. If this also entails and implies and leads to a large impact on our COVID-19 treatment and leading to delay in treatment of these COVID-19 patients. And we believe that this could also in turn have a large impact on our medical circle, and this will also have a large impact on our public as a whole. And during the past 12 rounds of meetings, we believe that there have been some disagreements. However, we shared the same view that we need to go towards the same direction. And in this process of negotiation and discussion, we believe that it was enough and sufficient for us to also share the same grounds on such goals. And right now, our efforts need to be concentrated in overcoming the fourth wave. And we ask you to refrain from such group activities, including the planned strike. And we sincerely ask you to also take immediate measures to solve these going forward. And we are also aware that the rest of the public are also very much concerned about the planned strike by the union, and the government will make sure to resolve this going forward. And in order to also prepare for all possible scenarios, we will also exert our efforts to have preparations. And first, in accordance to our legislations, we will make sure that we have the essential sustainable medical treatment that are needed, including the delivery of babies as well as other treatments. We believe that these will be carried out going forward, and we will also have an expansion of the operating hours of the hospitals going forward, and we will also be prepared to have more emergency operating hours for hospitals going forward. And we ask the rest of the public to only visit hospitals when it is necessary, and we believe that this could entail the rest of the public who are in much need to seek necessary treatment and medical care. Once again, we want to highlight that we want to urge that the union resolves these issues through dialogue and also negotiations with the government. We are also opening our ears to anyone that are wishing to talk with us, and we are also asking for your wise decision. Thank you very much.
이것으로 담화문 발표를 마치겠습니다.
That was Gwondeok Chur, the Minister of Health and Welfare of South Korea, giving the government briefing on the COVID-19 situation here in the country. To wrap things up, South Korea reported 1,372 new cases of COVID-19 on Tuesday, of which all but 39 were locally transmitted. This is the first time in 2 weeks for the country to report less than 1,400 cases. So far, nearly 30% of the nation has been fully vaccinated. For more, we'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.